let's talk about Candida today. And in dermatology OPD, it is a very common thing, especially in developing countries. So I'll first talk about the predisposing factors. I'll say in tropical climates like India, like ours, moisture is pretty much there. Obesity is also there because of the sedentary lifestyle. Diabetes is also like an endemic now. And in drugs, steroids, antibiotics, oral contraceptives are pretty much here. Pregnancy is also a stage where immunity is compromised and immunity is less than the normal person. So definitely pregnancy is one of the predisposing risk factors for Candida. Then immunosuppression. So basically wherever immunity is compromised, Candida is happening as an opportunistic infection. And also drugs where steroids obviously lowers the immunity, antibiotics obviously cuts the good part of the bacterial flora. So Candida becomes pretty much active. Diabetes is also an immunity compromised state. Obesity definitely helps in the fold, moisture in the fold where people are sitting too much, and there is not much activity, exposure to the air, exposure to the good environment, good sunlight is there, and moisture definitely helps because moisture is moisture. So clinical manifestations. First, we'll talk about Candida intertrigo. It is happening in flexures and interdigital area. So where are these? This is the flexure, like axilla. This is the axilla, and this is also under the breast area, the folds. So these were the areas where Candida intertrigo could be diagnosed, and then it was treated with azoles and polyenes. Yeah, and then in nails it is called as paronychia, candidal paronychia. In genital it is called as balanoposthiditis in males and vulvovaginitis in females. In oral candidiasis, a lot of manifestations are there. In acute, it can be pseudomembranous, this one. Then atrophic, it will be red in color. This is pseudomembrane. This is this artificial membrane all over, the curdy thing. And then angulostomatitis. Angulostomatitis is this angle of the mouth is inflamed. Also, there's a lot of if you take the history, patient will give you the history of lip licking, lot of lip licking, and the person is always having this saliva thing all over the mouth and the lip area. This, so you can always take that lip licking history. In chronic conditions of oral candidiasis, we can say chronic atrophic candidiasis and leukoplakia. So whitish curdy discharge, which is a bit adherent, and that can represent as oral candidiasis. Then cutaneous mucocutaneous variant, this mucocutaneous variant. And systemic candidiasis is when it is very extensive and invasive, and definitely in blood. So in dermatology OPD, what is the normal routine